what do you think are the social impediments in getting people to avail the screening?
Pranam, everybody. This question which you have posed to me, I would be strictly talking in context to India, because I have been screening the youth for the past 2.5 years, exclusively the youth, because entire thing which I have been listening throughout the talk, lot of new technology has come up and screenings are there for natal diagnosis and for diseases, and Sri Reddy ji has come up with very novel techniques of reaching the patients and maternal health and all. But to begin with, the first social impediment is people don't understand the term screening. They don't understand the term, what you mean by screening. If you go down, if I'm sitting in an Ithari village or I'm sitting in a Delhi University College branches, I'm telling you the range where we are doing a thalassemia screening. They first want to understand screening means what. Is it that you will tell us that we are suffering from some kind of a disease? Then we have to tell them no. Disease is one of the aspects that is more on the hospital mode. But if we are coming to your home and screening you, we are trying to find that you are a carrier or not. So they don't understand what the term carrier is. And I have not found media or apps, who educate people in a very simple manner, the way we did for polio. Very simple line, 2 बूंद खून की उसके दवाई के. ऐसे I also has this concept of Indian concept, that is why I was asking the language. 2 बूंद का निरीक्षण करो thalassemia से रक्षण. So we come up with their language, to tell them what is screening, what you have to do. So first of all, first social impediment is lack of awareness of the term screening, lack of awareness about what is thalassemia. I must tell you, rural India is not that much educated about the term thalassemia. The only thing they say is, ye koi khoon ki bimari hai. And the moment you say that, the second impediment comes up. Agar hamare andar niklegi, if that particular problem is there in us, it means there is some kind of, their cultural belief is that we are incapable. We are not having a full body with us. This is the exact words they use when you go to rural India and screen them. So second impediment comes that their social and religious beliefs tell them that the moment you find a disorder in you, especially the male folk, how will you then overcome that? So you are talking of prevention. You are talking of that such, things, such bad genotypes should not come into existence by thorough screening process and education. So social impediment includes what? First, lack of awareness of screening. Second, lack of awareness about the term thalassemia itself. And once you tell them what it is, there is a fear, phobia that comes up. It's a stigma to have a disease, especially a blood disorder. How will you overcome that? I'll tell you two things. I had a very new driver who came up. I said, okay, I'm doing this program. Come and have a screening test done. He said, come what me. मैं अपनी खून की जांच नहीं कर रहा हूं. मेरे में कुछ निकल गया तो मेरे गांव में क्या बोलेंगे? So in Indian context, you have to really understand this is a very big impediment. Stigma associated, that is the third social impediment which I found in my screening process. And then once you start telling them, run after them, get yourself screened, then you have the problem of lack of accessibility. Like lack of accessibility means you can take, I've taken this gazelle at 2-3 places. This machine was working very nicely there. But you require 4-5 of them. If there is 1,000 patients in a single camp, then you require many of these machines and many trained persons. Even though you will say that you take only 12 minutes to, 12 minutes only to look after to do the entire process, but 1,000 screening. Suppose you are screening a opportunity. So if you're 12 standard screening, that means you're screening. So accessibility at all the point of time, especially in the rural India, is not there. Okay, urban India, yes, there are so many foundations, there are so many philanthropic people who are coming up, and they are giving us, Thalassemic India is one of them. I was there in that program. They're giving us the opportunities, come screen the people. But still the accessibility to the rural India is not there. So this is another. There are a lot of things in policy. That is the last social impediment, I feel. There are a lot of things in policies. Good policies have come up. National Health Mission is there. There is a complete hemoglobinopathy 2016 report, prevention and control. Everything is working in place. But the implementation of those policies in true terms, where an academician comes up with a clinician, together with a social outreach arm, that is NGOs. These three confluence is required, because clinicians are sitting in their setup. People have to go there. On the other hand, the academicians are ready for mutational analysis and give you a very scientific input of improving and coming up with more machines. But to bridge them up, a good NGO coming up. I mean, REAN Foundation is doing a very good work. I was very happy to see a foundation here. So that bridge between that triangle has to come up in a very organized manner. So these are some of the impediments which I feel socially one faces while looking at the entire spectrum of screening. And it should, my mission here, I must say, is Rakt Kundli. I am very total bias towards my Hindi. So Rakt Kundli is something, if you can build it up at the right time, very early, catch them young, this will solve a lot of problem of managing the disease rather than controlling or managing. Rather, we should more harp on prevention of the disease.
Yeah, no, that was a fantastic overview of the range of complexities that come, especially from the social, cultural perspectives when it comes to screening.